You're listening to Aged Care Uncovered, shining a spotlight onto the Australian aged care sector, giving our older Australians and their families insight and a voice. Today's episode is sponsored by Aged Care Ready, assisting elderly clients and their families navigate the aged care sector. Now here's your host, Naomi Anderson.
Hello, and welcome to another episode of Aged Care Uncovered. My name is Naomi Anderson and I am your host today. And today, again, I am joined by the lovely Caitlin Cook. Hi, Caitlin.
Hi, Naomi, and hi, listeners.
How are you this week? Have you been well?
Yes, very well.
That's good. So, what are we talking about today?
Today we are talking about the day of admission. So much leads up to this moment, and you're finally in a new facility and there's a lot of uncertainty going on, so you don't know what to expect, what it's going to be like. And then it's kind of like a whirlwind of things happening and you get kind of lost in the day. So we're just going to step through that today and give you a bit of a picture of what that looks like.
So let's kick off by talking about what happens when you walk through those doors. Usually you'll be given a time of admission, and more than likely this is going to be before lunch. Do you want to explain why that is, Caitlin?
Yeah, so that's so you can get all the admission details sorted, then you can sit and have a nice lunch with your family before they head off and settle in.
Yeah, and it's usually helpful for the staff on that morning as well to have it before lunch, because it's kind of the middle of their shift is after the large medication rounds in the morning, and it's well and truly before handover, so that everything gets done before the next lot of staff come on in the afternoon.
Yeah, that's the perfect time for nurses on the floor.
Yeah, absolutely. All right, so what kind of things will happen once they're admitted or in the home?
So a lot of paperwork and a lot of questions are going to happen on this day of admission. So you'll be shown to your room and hopefully, and then you'll be seen by a lot of different people. Firstly, the nurse in charge, and they will run through a lot of admission stuff, so all the financial details and stuff, all the clinical stuff, which is very important. So we're looking at your history, your medications, making sure that's up to date, and they'll do a set of OBS and go through your general health at the moment.
Yeah, and what we call that is an interim care plan. So it's an initial plan of care, essentially, to give the other staff notice of how you need to be looked after, what they need to help you with and what they need to support you with. And this will change over time, and that will be redone to a normal care plan in about 28 days' time. But this initial step is just giving a broad overview of what care you or your elderly loved one need at that point in time, and then they will adapt from there. Yeah. And then from there, the nurses will also take a full set of OBS, which means they'll be taking your blood pressure, your heart rate, your temperature, and then cross-checking your medications with what's written on your medication chart. So generally, before you even get admitted or step foot into the facility, your doctor would have written up a medication chart for you to take with you. That'll be requested of you before the admission. And so the nurses will actually cross-check your medications that you've brought in with you against the medication chart that has been supplied. Or usually there will also be a GP that will come and see you in the afternoon of that admission as well to make any necessary changes and to do a medical admission of you into the facility.
Yeah, your preferences as well. So like what time you like to have your shower and get up in the morning. Any meal dietary requests and things like that as well. What activities you like to do. How do you mobilise around?
Yeah. And if you have a loved one coming in with you as well, they're likely to get screened and rapid tested as well.
Absolutely.
So let's have a chat about that initial 28-day period, because as you and I both know, Caitlin, that is what we call the settling period. And it's really probably the most difficult period of having to put your elderly loved one into care or being placed into care. Just because you're still getting to know your surroundings, the people that are caring for you, the other residents. Plus, it's also, it can be, I guess, a period of acceptance, especially if the person didn't actually want to go into care.
Yes, very much. So you're losing your whole routine and your whole previous life in a sense, and gaining all this, and probably not used to as many people around, not seeing your family as much. It can be really, really challenging, but however, it will get better, and normally I do find that they do come around and they do have a better quality of life and enjoy themselves after that initial period. But that first period is really challenging, I'm not going to lie.
Yeah, it can be really challenging. And I guess it's a bit of a grief process because your loved one's losing their independence essentially. However, what we find is that if they're placed into the right facility, they themselves will flourish with really good care. And we've seen that firsthand.
Yeah, absolutely. So in that settling period, you can expect maybe a period of withdrawal. So not wanting to leave their rooms as much. Yeah, all that uncertainty. But yeah.
Anger, guilt, yeah. Yeah. I think this is the time that really families get the most phone calls from their elderly loved one, just needing a little bit more emotional support and some reassurance. And I guess that's really important at that stage to be having open lines of communication with the facility so that they can step in and offer redirection, distraction, include them in more activities that, interest them. But like you and I have both said, it really is just that initial settling period, and they will settle after that.
Yeah, there's also supports that you can lean on here too, like your social work, your psychologists. A lot of facilities have like chaplaincies and support people specifically for this kind of thing. So lean on them as well.
I think it's important here to note that it's not just the elderly person who is going through this settling period or adjustment period. They really need to consider how it's treating you as a family member as well, because I don't think it's easy for family to have to go through this, because you've always known your elderly loved one in a particular way, and then having to see them go through this process. Again, like I said, it's not just a grieving period for them, it's a grieving period for you as well.
Yes, absolutely. So that parent child relationship is changing, so you're often becoming the carer now, whereas they've cared for you your whole life, and that's changing. And I also found a period of guilt and like questioning your own judgment, like, is this the right time, especially when you're getting that bit of pushback. Really questioning your own choices, and but I can assure you it will get better.
Yeah. And like we've always said, carer fatigue is a huge thing. And until you've been through it, you don't really understand how much of a toll it takes on your body. And it's easy to look through rose-coloured glasses at the situation, that when mum or dad have been in care for a week or two, you feel okay and that maybe you should be taking them back home. but you're just restarting that cycle.
Yes, absolutely. There's probably a reason that triggered all these events to go into care, and it was probably often safety for your loved one, and it's important to keep an eye on that as the bigger picture. Safety is the most important thing, and quality of life.
Yeah, absolutely. And like we said, they will settle as they get to know the staff, the facility, and make friends with the other residents. You'll find that they will settle, and this period is only temporary. Yeah. Anything else you'd like to add, Caitlin?
That first day will go really quick. It will be an absolute whirlwind. You'll be so tired by the end of it, and just orientating to a new facility too, like trying to figure out the layout, the routines there as well. So just be prepared for that big day. You'll sleep well for sure.
Absolutely. Well, thank you for joining us for another episode of Aged Care Uncovered. We would appreciate you subscribing to our YouTube channel or our podcast channel, or you can find us on our Facebook business page or LinkedIn. If you are going through something like this currently and would like to surround yourself with a community of people who are also going through something similar, you can also find us on our Facebook group, which is called the Aging Parents Support Group over on Facebook, like I said, and we will see you next week. Bye.
Bye.
Thanks for listening to Aged Care Uncovered. If you enjoyed today's episode, head on over to your favourite podcast streaming app and give it 5 stars. If you have any questions about today's episode or about aged care in general, please contact us.